Okay, well, I have 1 o'clock, so we might as well get underway. I want to welcome everyone to the Safe Routes to School Coaching Action Network webinar. My name is Michelle Gully, and I'll be facilitating today's webinar. This call is part of a series of webinars developed by America Walks and the National Center for Safe Routes to School. The goal of this program is to educate individuals and organizations on topics that may boost the overall success of Safe Routes to School projects across the United States. The National Center for Safe Routes to School and this program have both been made possible by funding from the Federal Highway Administration. So before we get started, I do want to just go over a few administrative details. Please note that all of the attendee phone lines are muted. Due to the large number of participants that we have on these calls, this helps to cut down on confusion and background noise, makes it more enjoyable for everyone involved. If you do have a question during the webinar, please use the question and answer box on your computer screen, and I'll read the questions as they come in and respond if I'm able. If you cannot access the webinar program at all, but obviously you can hear me, please send me an email at mgully@americawalks.org. That's MGULLEY@americawalks.org, and I'll do my best to help walk you through some steps to get you online with us. Also note that the webinar is being recorded, so if for some reason you cannot access the program at all, you will have a chance to download it at a later time from both the America Walks website and the National Center for Safe Routes to School website. And those addresses are www.americawalks.org and www.saferoutesinfo.org. Now, questions pertaining to the subject matter of the presentation may be entered at any time during the presentation, but will be addressed at the very end. We do try to save about 10 or 15 minutes at the end for questions. We ask that if you have a question about Safe Routes to School that does not pertain to today's topic, that you please submit those directly to the National Center for Safe Routes to School via their website. And again, that address is www.saferoutesinfo.org. If you weren't able to get all that information down, and it was a lot of different web addresses that I was giving you, please do not worry. I will post them again at the end of the webinar along with contact information for our wonderful speakers that we have today. So now I would like to briefly review the agenda. You should see it up on your screen at this time. You'll note that we've already gone over the first point, which is the welcome and administrative details. Next, we're going to move on to our wonderful feature presentation, which is Active, Healthy, and Ready to Learn, Safe Routes to School and Children's Health. We have two great speakers for you today. We have James Salas. He's a PhD and Director of Active Living Research and Distinguished Professor from Family and Preventative Medicine at the University of California, San Diego. And Jason Mendoza, who's also a doctor, Assistant Professor of Pediatrics, Baylor College of Medicine, USDA ARS Children's Nutrition Research Center, and Academic General Pediatrics. Boy, with those pedigrees, it's certainly a mouthful, guys. So with that, since we have these great speakers for you today, I am going to turn it right over to Dr. Salas so he can get us started. Give me one moment to take care of that. And there we go.
Okay, hello everybody. Let me bring up my slides. There we go. All right, thank you, Michelle. I'm really happy to be able to speak with everybody today. And one other thing on my pedigree is I'm on the advisory board for America Walks, so I'm happy to play this role for an organization that I think is doing great work. All right, so I am going to do a little bit of introduction about Safe Routes to School, just to make sure everybody knows what it is and why it is, and then I'm going to outline some evidence about Safe Routes to School so that we can develop our interventions and promote Safe Routes to School in an evidence-based way. So that's what we try to do at Active Living Research. So let me just get on with it. Okay, this is what we want more of, children walking to school. But and so what is Safe Routes to School? It is a national and international movement to create safe, convenient, and fun opportunities for children to bicycle and walk to and from schools. So I like to call this active transportation. And if they want to skateboard or go on little push scooters, that's fine too, because they're all active. And so why is this important? Well, there's a number of reasons. Americans drove about 30 billion miles and made 6.5 billion trips in 1 year to take children to and from schools. It's 10 to 14% of traffic during the morning commute. So just think how much better everybody would be off if most of those kids walked or biked to school. More cars off the road, much less pollution, lots of benefits. Approximately 23,000 children injured every year, and more than 250 killed while walking or biking in the United States. So these are this is why we need to make the routes safe, because these fear of traffic is one of the big barriers to walking and biking to school. All right. And so the core of Safe Routes to School is the 5 E's. And for some people, they're the 4 E's, but engineering. And so that means basically pouring concrete of some sort to make sidewalks, to paint crosswalks, to slow down traffic, various things that the roads department does. Education. Educating kids about how to walk safely, about why to walk, educating parents, a lot of things that can be done there. Encouragement, that might include walk to school or bike to school days or weeks, having incentive programs, many options there, and then enforcing probably most particularly traffic speeds in school zones. That's an important thing. Of course, some schools decide they're going to enforce a policy of no walking or biking to school because that's their solution to danger. Okay, if it's dangerous for kids to walk and bike to school, all right, we'll just ban that, and then we won't have that problem anymore. But, of course, that creates other problems. And then the 5th E that certainly we like to include, isn't always included, is evaluation to see if any of these things are working. So here's the picture in the United States. You can see down at the bottom, these are for grades K to 8, and then that's broken down K to 5 and 6 to 8. And you can see that grades 6 to 8 are a little bit less likely to walk to school. But if you look overall, in the 1969, almost 50% of kids usually walked or biked to school. That's down to about 13 or 14% now. So a dramatic decline in not too long a time. So this is what we're looking at. This is why I call walking and biking to school endangered because of this. And the distance to school is a big driver, of course, of how many kids are walking. So for kids that live less than a quarter mile to school, about 55% of them are walking, and that's in 2009. So that's still. So think about what that was in the 50s and 60s, and then it goes down dramatically, and then almost no kids walking or biking at greater than 2 miles. And there are different numbers for biking, but the biking rates are extremely low, so I didn't even include those. So one of the things that I'll come back to on this is that one of the most effective things that we can do, at least in the long term, for getting kids to walk to school is to make sure that schools are near where children are living. And that's not the way we build communities these days. And so that's part of why walking and biking to school have declined, is because we've separated schools from where the kids are. All right, so now a little bit of data. This is a review about how children's active commuting to school contributes to physical activity. And I just took a quote from this. data from several studies now indicate that children who use active forms of travel to school accumulate about 20 additional minutes of moderate to vigorous physical activity per day. So that's about 1/3 of the 60 minutes recommended. So that's a significant bit of activity. And so they expend about 30 to 45 more calories per day than youth who are driven to school. And so if you multiply about 35 calories times the number of days in a school year, you get about 6,300 calories for daily walkers. And so that would approximately equal about 2 pounds of weight gain prevention. And so active commuting to school could help us control the obesity epidemic. I just found another paper that was published this month in American Journal of Preventive Medicine. It's a study of a small number of British children, but they wore accelerometers which objectively measure their physical activity. They're like smart pedometers and GPS units, so they could see exactly where they went. And so they could measure with a lot of accuracy how much physical activity they did on the school journey. And so the active school journeys contributed 22 minutes of physical activity, or 34% of their total daily physical activity, and results were similar for boys and girls. So there's really a lot of evidence showing that kids who actively commute to school add most of it to their total physical activity. They don't just say, okay, I'm done with activity. Now when I get home, I'm just going to watch TV and eat. All right, so there's a little bit of evidence about walking to biking to school reducing the risk of being overweight or obese. It's really been fairly difficult to find this in the U.S. data because so few kids walk and bike most days. But in Denmark, there's quite a group that walks and bikes very frequently. And so what this shows here, that compared to the blue bar, which is those who passively commute, cars or buses, that those who walk are about 50% less likely to be overweight or obese, which is a big reduction. Those who cycle are about 40% less likely to be overweight and obese. So this is pretty powerful data showing that, again, more active commuting could be helpful in preventing obesity. All right, so they're going to school, and we have this struggle of trying to get school officials to value different options for getting kids active. And so it's important to examine whether active commuting, or different physical activity promotion strategies are related to academic performance. And here is a study in Spain where they showed that active commuting to school is related to several types of standardized achievement tests, which, of course, the education officials value a great deal. And so the bars are, as you can see, the dark ones, passive commuting, and then I think the next one is actively commuting less than 15 minutes, and then the white is actively commuting more than 15 minutes. And you can see for the girls that there are significant relationships here with all of the academic outcomes: verbal ability, numeric ability, reasoning, and the combination. So if you see the combination here, it's really a dramatic relationship there. And with boys, none of these are significant, although there are a little bit of hints. But it's interesting. We do find this relationship with girls. So there is this at least one study linking active commuting to school directly with academic performance. All right. Now I'd like to get into the link between community design and some of our transportation policies and active commuting to school. This is what I like to think of as part of an active living community where you have homes near destinations, and that depends on the way the community is designed, whether it's connected streets and mixed land uses or separated suburban land uses. And then it depends on, you need to look at where the schools are. Are they close to the kids? Do they have athletic facilities, and are they open to the public after school? And then parks and recreation facilities, which we won't be talking about today. But linking all of these pieces together is the transportation system. And so for Safe Routes to School to work, we found out that schools must be near homes, near enough to walk or bike, and that depends on the way the community is designed. And it also depends on the transportation system and whether there are sidewalks and whether the cars go slow enough to make the kids comfortable. All right, so there is a link with walkability. And so very simply, walkable community is mixed use, so you've got a range of land uses together. The streets are connected, and they tend to be dense. This happens to be the most walkable neighborhood in the United States, and probably you all recognize that as Manhattan. Here is the antithesis. It's a place that's not walkable. It's not designed for pedestrians. It's assumed that people will not walk. And so you see the streets are not connected. They're very long blocks. There's no mixed land use. This happens to be a commercial area. And you see there's no provisions for pedestrians at all. And this poor fellow over here is at risk for his life because of the poor design and lack of consideration for pedestrians. So so you can imagine if you're a child, you have to cross this road on your way to school. That's going to be a big, scary barrier. All right, so I want to just mention a few results from a couple of our studies that show the relevance of neighborhood design for active commuting to school. And so I just show you one finding from our neighborhood quality of life study and one from a similar study done with teens. And both of these, we're studying different environments, and so we identified neighborhoods that were low and high in walkability, and we did this in Maryland, a pretty big chunk of Maryland around Baltimore, and in the Seattle, Washington, King County area. So we're looking for high and low walkable neighborhoods, but also high and low socioeconomic status neighborhoods, so we could see whether the walkability effects are similar by neighborhood income. And so what we did, so really we have these, what we call the four quadrants, okay, these four types of neighborhoods. And in one study that we did, one analysis that we did and published a few years ago, we had about 200 parents of children that told us how much their kids actively commuted. And we found that the active commuting was more than double. More than twice as much in high walkable as in low walkable neighborhoods. And the biggest predictor of that walking was, or biking, was parent concerns. And those concerns were mostly about traffic. Because in the low walkable neighborhoods, people have to drive everywhere. And that creates a lot of traffic, and much of it very fast. And so the parent concerns were higher in low walkable neighborhoods, even though a lot of people move to the suburbs because they believe, okay, this is going to be better for my kids, but then not in every way. In a similar study we did with teens, we call it the TEAN study, we asked the teens how many trips per week they made actively commuting, and it was on average not too bad. But you see, in the high walkable neighborhoods, it was about 2.5 trips a week out of 10. So that's a fairly low baseline. And then it was more. It was less in the low walkability neighborhoods, and you can see a bit more of a difference here in the high income. And a smaller difference, but still a difference in the low income. And we suspect that's because in many lower income households, they didn't have enough cars to take the kids to school. So the built environment is important for active commuting to school. And one of the things that we're finding is that the suitability for walking and biking differs by income. And so we asked people about characteristics of their neighborhoods, and this is people reporting on the adequacy of walking and cycling facilities. And the point here is that there's a difference in low income and high income. It's not a big difference, but it is significant. We see bigger differences in pedestrian and traffic safety. And this is how fast are the cars going? Are there safe places to cross the streets? And you see really major differences here by income and also by walkability. So that the kids in the low income neighborhoods are disadvantaged in this way. And also when we look at perceived crime, we see big differences by income. And you see for the high income, no difference by walkability. But the point here is that there's going to be more concerns about crime in the low income neighborhoods. So these are some things that we can intervene on and try to reduce some of these disparities in neighborhood environments. Now, the big question really is, do Safe Routes to School programs work? And we frankly have not had good evidence about this, but I just happened to come across this brand new report that was published just last month. I found it on the Safe Routes to School National Partnership website. And I put the website for the report down here. So this was done by Anvernay Moudon and Orion Stewart there at University of Washington, and did this through the Washington State Department of Transportation. I just want to give you some highlights, culminating with an evaluation of whether Safe Routes to School funding is making a difference. So this is a study of federally funded Safe Routes to School projects in 5 states: Alaska, Florida, Mississippi, Texas, and Wisconsin. In these states, there were 569 projects that were announced that had federal funding. These covered over 1,400 schools, almost 800,000 students, or about 10% of the pre-K through 8th graders in the public schools in these states. So it's a small percentage of the 80,000 or so schools in the U.S., but it's a good sample for a study. 72% of these projects were infrastructure, meaning they built something, and I'll show you what they built. 28% were for non-infrastructure, media, promotion, safety patrols, and walk-to-school days. So a variety of projects that were done. And so this has to do with how many E's of the engineering, education, encouragement, and enforcement were done. And you can see that some of these had no E's at all, and those were basically for planning and for hiring a Safe Routes to School coordinator, and so those are reasonable uses of the funds. But almost really about 60% of them only dealt with one E. And a few of them were more comprehensive. And you can see only about 10% dealt with all 4 E's. And theoretically, we would expect that the more comprehensive a program is, the more effective it would be. So you can see that a lot of the states are requesting things that are not particularly comprehensive. And of those projects that included some kind of infrastructure, this is what they did. So far and away, the biggest category was sidewalks, building or improving sidewalks. And you can see that that's important. If you don't have a sidewalk or they're really poorly maintained, that could make a big difference in parents allowing their child to walk to school. Crosswalks is directly focused on improving the safety, so that's good. Signage, pretty low cost. ADA improvements, improving access to people with disabilities, and smaller numbers with bicycle racks, traffic calming, shared use path, bicycle lane, and a pedestrian bridge. Pedestrian bridge is pretty expensive, just a handful of those. So you can see what's being done here. And, the basics, crosswalks and sidewalks. I think if you don't have those, that's a really good place to start. All right, so here are the results from those 500, well, I don't think it was actually that many, 569 that they evaluated, but those projects in 5 states that had before and after results. And so you can see that walking was 10% at baseline, bicycling was 2% at baseline. Not too different from the national average, maybe a little bit lower. And so there was a significant improvement, certainly in walking, going from about 10% to about 14%. So that's a 40% increase in walking to school. So I certainly would conclude from that the Safe Routes to School funding in these geographically and diverse states looks like it's having an impact on walking, and I would say really not really an impact on bicycling, which is low to begin with and didn't increase much. So that's, I think, some good news for those of us interested in Safe Routes to School. And I will mention that Active Living Research, our program through the Robert Wood Johnson Foundation, has funded two or three other evaluations of Safe Routes to School around the country, and those will be coming out hopefully within the next year. And I would just like to end by inviting you to come to our Active Living Research website. We have a wide range of materials and products for you, and here you see some of these academic journals that we produce every year, one a year, and those are free and online if you're so inclined. If you rather would have it summarized for you in a easier to understand method, then on the bottom here are our research briefs and syntheses and some case studies really designed for policymakers, for practitioners, and for advocates. And we have a wide range of them, including one specifically on active commuting to school. And so as my last slide, I just give you a couple of links. We have, here's how you can get to the research briefs on our website. Here's how you can get to slides. We have just a collection of slides giving results from a variety of studies, a few of them on active commuting to school, many on other things. And then I'd just like to say that the Safe Routes to School National Partnership has a wonderful array of resources and ways to get involved. And there is my email. So thank you for your attention. And Michelle, I'm going to hand it back over to you.
Thanks, Jim. We'll just turn it straight over to Jason so he can get going. Thanks.
Great. Thank you. Hello, everybody. It's a privilege to present to you all today. I just want to first of all thank Michelle and Jim for inviting me to present this work. So as we heard before, I'm a pediatrician and a behavioral scientist, and I am interested in helping to reduce the burden of obesity and to increase children's physical activity. And one thing that struck me as a pediatrician was that this wasn't going to happen necessarily simply by telling people to do this in my office. And so I was looking, that led me to looking at broader ways to impact populations. So let's see. So as you all know, childhood obesity is, there are pretty high rates in the United States. It's about 17% for 2 to 19-year-olds being obese in the latest national assessment through the Centers for Disease Control and Prevention. This 17% doesn't include children and adolescents who are overweight. That would add another 16 or 17% to that figure. In another study looking at only at 4-year-olds, so looking at younger children, about 18% were classified as obese in 2005. So, this means that we definitely need to do something about this. These figures represent about a 2 or 3-fold increase in the last 20 to 30 years for rates of obesity. And as many of you know, obesity disproportionately affects certain racial ethnic minorities and low-income children. So if you compare Latinos and African Americans to white children in the United States, you can see that Latinos and African Americans have significantly higher rates of obesity. And then for those of you wondering what is the cost to society, a recent study on the cost of adult obesity by Finkelstein and colleagues basically showed that we as a nation spend about $147 billion, with a B, $billion every year for obesity-related costs. And so as a physician, I'm interested in, of course, the medical complications of obesity. And many of you know already that obesity has been associated with higher rates of, or higher risks for stroke, heart disease, and diabetes. And then some of you also know that obesity is related to a higher risk of multiple different types of cancers. Now, I would argue that the general public doesn't necessarily realize that there is this link between obesity and cancer. I think they're much more familiar with obesity and diabetes, or obesity and heart disease. But there is a substantial association with cancers as well. And so if we can reduce the burden of obesity, we will also reduce the burden of cancer. So as you all know, physical activity is very important for obesity prevention. But regardless of how much you weigh, physical activity is important for preventing cardiovascular disease, type 2 diabetes, and multiple different types of cancer. So regardless of what a person weighs, it's good to be physically active. And physical activity, as was already presented, it's positively associated with cognitive and academic outcomes among children. So the more physical activity children get, the higher their test scores are. So, in fact, schools that may be cutting back on physical activity time, whether it's physical education classes, whether it's recess, or walking and biking to school, with the thought that they'll have more time for academic studies and getting kids prepared for tests, they actually may be worsening things for their students. So how are we doing in the United States? How physically active are we? So here we have data from the National Health and Nutrition Examination Survey. So this is national data, and basically on the y-axis is minutes per day of moderate to vigorous physical activity. So this is the type of physical activity that gets your heart rate elevated and gets you breathing quickly. And so, as many of you know, children and adolescents are supposed to get a minimum of 60 minutes per day of moderate to vigorous physical activity. And the way this was measured was using accelerometers. So these, like Jim said, these are basically very fancy pedometers that objectively measure physical activity. And you can see that the younger kids do a fairly good job of getting the minimum amount of moderate to vigorous physical activity. But then you can see once we hit the teen years, it just drops off. So teenagers are getting far less physical activity and not meeting the recommended guidelines. And so this is a large opportunity to improve children's health in the United States if we can get their physical activity up. So walking and biking to school, as was already mentioned, traffic is a major barrier for active commuting to school, and safety concerns. Safety concerns meaning people worried about who the children may run into on the way to school, who they may encounter. So as we know, active commuting to school, it appears to be promising to increase children's physical activity and active commuting to school, so I'll just say ACS as an abbreviation. It's increasing it is a national health objective of U.S. Healthy People 2020. So as was already mentioned, if we ask kids to walk and bike to school, or if we ask more kids to walk to school, that could increase their risk of child pedestrian injuries. And as you know, injuries are the leading cause of death in U.S. children and adolescents 1 year of age and older. So we don't just want to basically tell kids, hey, just go out and walk to school without giving them proper instruction and guidance on how to do it safely, and equipping our communities to make them more safe for children to walk to school. Oh, and this picture right here is a walking school bus that we did here in Houston. And I'll be going over results of that walking school bus in a few slides. So speaking of walking school bus, what is a walking school bus? Well, as many of you know, it's part of the encouragement part of the Safe Routes to School program. So basically, it's a group of children led to school by adults who walk together along a set route. And this program basically addresses many of the safety concerns because there is adult supervision there. And because there's adult supervision, there is the opportunity for developing children's pedestrian safety behaviors. So you can actually teach kids how to cross the street safely to and from school, and allow them to practice that on the walk. So it's a great opportunity. And here are some pictures from a walking school bus that I was involved with in Seattle with a great organization, Feet First. And you can see on the far left bottom picture, that's the person smiling there is the principal. So we have indirect evidence of positive outcomes from the walking school bus. So approaching Safe Routes to School, these were the basic research questions that we had in mind. So in the first place, can we increase children's active commuting to school? And does increasing children's active commuting to school increase their physical activity? There is a thought that if you change children's physical activity, they may compensate for it by being less active in the day. So we wanted to see, can we increase their physical activity over the entire day? And another question was, does active commuting to school decrease children's risk of obesity? That's one of the big questions out there. And then also, safety-wise, can active commuting to school and interventions, can they improve children's pedestrian safety? And one of the questions that I'm very interested in is, can active commuting to school interventions work in ethnic minority and low-income communities? As many of you will remember, ethnic minority and low-income communities are disproportionately affected by childhood obesity and by child pedestrian injuries. And so it would be great if these types of programs can work in those communities. So to begin to think about active commuting to school, here's a overly complex theoretical model that we like to use to frame our thinking about active commuting to school. So let me just simplify things. We're most interested in active commuting to school and its impact on MVPA, or moderate to vigorous physical activity, and impact on BMI Z-scores. So that, a measure of body fatness. And also the other outcome we're interested in is pedestrian safety behaviors. How does it impact pedestrian safety behaviors? And I will shortly show results of a walking school bus program and its impact on those outcomes. So one of the first studies we conducted was to examine some of the big questions. Is there an association between active commuting to school, physical activity, and children's body mass index? So for this, we used the National Health and Nutrition Examination Survey, and we looked at it among 789 adolescents, so starting around 12 years of age. That's the earliest age where they asked the children how they traveled to school on a usual basis. So that's why it only goes down to 12 years of age. In that data set, they also measured children's, or the subjects' moderate to vigorous physical activity using accelerometers, and they also measured height and weight so that BMI could be calculated. And the results were that active community school was positively related to children's daily moderate to vigorous physical activity, such that for every 30 minutes of active commuting to school, which is a reasonable time for teenagers to walk, bike to school, they accrued an additional 4.5 minutes of moderate to vigorous physical activity. And then looking at the questions of BMI, active commuting to school was inversely related to BMI Z-score as expected, and inversely related to skin folds, which is a measure of body fatness. So as expected, with more active commuting to school, there were lower BMI and lower skin folds. So the next study we conducted was a quasi-experimental trial of the walking school bus in an inner-city public elementary school in Seattle, Washington. So here we are trying to extend Safe Routes to School research to low-income populations. So for this, we had one intervention school and two comparison schools, and this is the study that we conducted in collaboration with Feet First. The intervention school at 1 year had an increase of 18% for active commuting to school versus the two comparison schools at 1 year. So there was a long-term impact on rates of walking and biking to school at this low-income school. So here is some evidence of walking school bus and Safe Routes to School programs working in those settings. So this brings us to one of the larger studies that we conducted, which was funded through the National Cancer Institute in part, and by the Robert Wood Johnson Foundation Active Living Research Program, which is Dr. Salas's organization. So what we wanted to do for this was conduct a randomized controlled trial of the walking school bus program in low-income schools. And so for this, because I had moved to Houston, we conducted it in the Houston Independent School District. We had 4 intervention and 4 control schools. And again, these were low-income schools. And we matched intervention and control schools based on race, ethnicity, socioeconomic status, and then randomized them. For this experiment, we enrolled 4th grade students. And beginning in March of the year, we basically formed walking school bus routes and had study staff lead the students up to 5 days per week to and from school. And students and parents decided when they would walk with the walking school bus. Parents did not have to walk at all with the walking school bus. We wanted to make this easy on the parents. And you can see that the average route was about a little less than a mile long and had 8 to 12 students per 2 adult walking school bus staff. Now, the control schools got the usual information on walking to school provided by the district. And again, we took baseline measures prior to enacting the walking school bus. And then we measured, we got follow-up measures during weeks 4 and 5 of the walking school bus. So this is really a short-term study. And so our primary outcome was the change in percent of trips made by active commuting. And for this, we used our validated school travel survey. Our secondary outcome was moderate to vigorous physical activity measured by accelerometers. And then another secondary outcome was pedestrian safety behaviors, in which we used a validated checklist that we developed on all child pedestrians walking to school at times 1 and 2. And let me just show you what we examined in that checklist. We basically want to look at some of the fundamental behaviors that children are supposed to use when they walked. So did they cross at a corner or crosswalk? Did they cross with an adult or safety patrol? Did they stop at the curb? Did they look left, right, left? Did they keep looking while crossing? Did they walk and not run across the street? It's safer for younger kids to walk rather than run across the street, of course. And then did they wait or follow the traffic signal if there was one at that intersection? And here's just a look at our participants. The picture on the left was taken at around 6:30 in the morning, very early, and you can see that the students were smiling somewhat, and we basically had them start that early so they can make it to school for the school breakfast program. So the baseline prevalence of active commuting to school in this sample was about 34%, which is fairly high. You can see most of them were 9 to 10 years of age. About a third of them were Hispanic, and then another third were African American. And you can see that most of them came from lower income households. So results. So here we have the main result, which is active commuting to school. What is the percent of the week done by active commuting to school? And you can see that at baseline there was no statistical difference between the two groups. But during weeks 4 to 5, the intervention group had increased by 30%, and the control group had decreased their active commuting by 8%. So there was a 38% difference between the two groups, and this was highly significant. And here we are looking at objectively measured moderate to vigorous physical activity. Again, at baseline, there was no difference in their moderate to vigorous physical activity. However, at follow-up, the intervention group increased by 2 minutes, and the control group actually decreased by about 5 minutes. So there was a 7-minute difference in their daily moderate to vigorous physical activity, and this was statistically significant. So the kids, in fact, didn't end up, at least the walking school bus kids, they did not end up compensating for increased physical activity by being less active in other parts of the day. They actually increased their overall total daily moderate to vigorous physical activity, which was very nice to see. And then looking at the pedestrian safety behaviors, comparing intervention to control, you can see that crossing at a corner or crosswalk, there was a 5-fold increase in children at the intervention school crossing at a corner or crosswalk. Now this is an important thing because, as many of you know, about 75% of traffic injuries occur at non-corner or non-crosswalk locations. So if we can improve this behavior, we may have a large impact on children's pedestrian safety. Now, those of you will also notice that stopping at the curb, there was an actual 5-fold decrease in children at the intervention school fully stopping at the curb. So let me just explain that. Children did not get credit unless they fully stopped at the curb. They couldn't do a rolling stop like some of us do when we're driving a car. So the issue with this is at the intervention school, the children were walking in groups a lot. And so when you walk in a big group, usually it's only the leaders who stop at the curb, and the people behind the leaders, they stop like on the sidewalk and not necessarily at the curb. So those kids wouldn't get credit for stopping at the curb. And so we think that might be the reason why that decreased so much. The children were walking in groups, and they may have been told to cross by parents or crossing guards as part of those groups. And so when you're told by a parent or crossing guard to cross the street, you don't necessarily fully stop at the curb and then and then proceed. You often just continue to cross while there is a window of opportunity to cross. So let me just summarize the findings from these studies in low-income schools. So we were able to show that our walking school bus increased active commuting to school. It decreased car transport. So I didn't actually show this, but there was a 35 or 36% decrease in children being transported to school by car, which is excellent. And the walking school bus addressed common barriers related to safety and distance. We're happy to report that the walking school bus improved children's daily moderate to vigorous physical activity, and it also seemed to be a promising intervention to improve children's pedestrian safety behaviors. So let me just talk about some future steps that we're taking actually right now to address some of the shortcomings of the research that I presented. We are in the process of starting a long-term study on the walking school bus program in low-income schools. Again, for this study, we're actually going to examine the built environment and walkability, since, as Jim alluded to earlier, that is an important influence on children's walking and biking to school. And so we're going to actually consider that in this larger study. We're going to look at children's body mass index, and we're hoping to look at test scores, academic achievement, and then parenting practices related to getting their kids to walk to school. And then we're also interested in bicycle trains. So as many of you know, bicycle trains are very similar to walking school buses. It's just that kids and parents bike to school in groups rather than walk to school. So we're interested in looking at feasibility of this in low-income areas and impact on bicycle safety. And then there are some neglected groups for this type of research, namely middle and high school students. And so we're also interested in looking at the impact of mass transit, bicycling, and parking incentives and disincentives for getting middle and high schoolers to walk and bike to school. And I'll just list some websites on walking school buses and Safe Routes to Schools programs. And let me just end here by saying thank you and provide my contact information.
Great. Well, thank you so much to both Jim and Jay. That was a wonderful presentation. We have a few questions for you. So let's see here. Dr. Mendoza, why don't we give you a break and let you catch your breath? And I'll put up your contact information on my slide so that folks can see that. And Dr. Salas, we'll start with you. How's that?
Sure.
Okay, so one of the questions that I have is how was the walkability defined in the teen study? Was it street connectivity only, or were there trip generators nearby?
Right. We had a four-component definition that we combined into an index, and so that was related to an indicator of the mixture of land uses, several different land uses being nearby, the residential density, the street connectivity, and also the floor area ratio of retail areas. So for a retail area, we computed the floor area ratio, which is the building square footage over the land square footage. And so if it's in a walkable area, that index is going to be high because the building takes up all or most of the lot, and it may even be multiple stories. Whereas in a low walkable, and so that means that the building is right on the sidewalk. In low walkable, it's more like a Walmart, right? You've got a giant land, most of it in parking lot, and then some building as well. So that ratio would be well below 1, whereas in a high floor, high walkable area, the floor area ratios are greater than 1, or often greater than 1. So we basically combined all of those, measured in geographic information systems, and created the walkability index.
Great. Thank you so much. Okay, and let's see, Dr. Mendoza, we have a bunch of questions for you. People are very interested in this walking school bus. Let's see, one of the questions that came in was, what was the usual, in quotes, information the control schools received from the school district?
That's a good question. I think it varied somewhat by school, but basically parents received information on whether they were eligible to be bused into school, and that the busing boundary in Houston at the time, it was about 2 miles, greater than 2 miles, and then supposedly they received maps which may have had suggested routes to walk to school. But I think it really was up to the principals, the kings of the kingdom or queens of their kingdom to decide what got sent in the welcome packets to the families.
Okay. And again, these next few questions are all about the walking school bus, so we'll stick with that theme. In the pilot program that you were working on, was there an effort to get parents kind of engaged in the program, and did you kind of focus on sustainability, or was it just more of a kind of isolated thing that you were working on?
Yeah, it's a good question. So so the grant was to do an experiment, a study, and to basically provide proof of concept so that we may motivate other programs or schools to do this type of program. So that's why we used study staff rather than parents. I think it's a good. The interesting thing was some of the kids actually did not want their parents to walk with them. They thought of this time as their own time to be with their friends and to have a good time getting to school. And so there were some parents who actually walked to school but went along a different route and met their kids at school. But the kids raised objections to having their parents walk with them. So I think in future studies, though, we definitely want to look at organizing and involving parents as the primary people to walk the kids to and from school, and provide information to others on how that goes in low-income communities.
Sure. It's that age group, the 10 to 12. I can see that, them being kind of embarrassed by their parents. Okay, a couple more walking school bus questions for you. People are very interested in this. These, I'm just going to kind of group all these together. You can answer them together. It's like people want to know how long did it last and how many kids were involved.
Okay, so for which program? The one in Seattle lasted, I believe, about a year. About 18 months, I believe it lasted, maybe 20 months. So that was like a fairly long-term study. Though the short study here in Houston lasted only the study itself lasted about 5 or 6 weeks, but we kept the walking school buses going until the end of the school year, so for another month or so, with the hope that if, maybe the kids and parents would get interested in continuing it on their own in the following year. Unfortunately, we were not funded to keep things going in subsequent years, and especially in these low-income schools, the resources are fairly tight, and so the principals, although they oftentimes loved the program, they didn't necessarily have the resources to devote to keep the program going beyond the original study period.
That's actually interesting. It ties into the next question. Do you know what happened with the programs after you left? You mentioned that they didn't really have any resources to focus on them. Yeah,
so I think what happened was a lot. So once our study staff wasn't able to walk the kids, I think some of the kids actually kept walking and biking to school, although, we didn't measure this, so this is all anecdotal stuff we're hearing through the parents, or not through the parents, but through the principal and through the teachers. Some of the kids kept walking, but they didn't necessarily have adult supervision on many of the days, which is, probably okay. Kids eventually need to learn how to independently walk, bike to school, although some may argue it's too early in 4th grade. But I think the reality is that in the inner city, where families may have less resources and less time to get kids to school, there are many kids who, at young ages, do just walk to school because that's the only way they can get there.
Sure. Okay, and you already answered part of this question. Part of the question was who were the walking school bus escorts. You mentioned that it was some of the staff that you were working with. But how much training was provided? Was it intensive? Did it take a long time to get them kind of up to speed to be able to start the program? Or?
So the training was provided by David Levenger, who I imagine many of you know. He was the executive director or founding director of Feet First in Seattle, and he came out to help train my staff here. And it was basically our training for the walking school bus took about half a day. So we had a half a day on principles of the walking school bus program itself. And then we had another half day on how to do the evaluation, which I would imagine most people wouldn't be interested in doing this type of rigorous evaluation with accelerometers and things. So really, it took about a 4-hour training with the staff members, and then every week we would meet on a Friday to kind of discuss what was going on at the different schools and troubleshoot things.
Okay, great. And the final question, so we're coming right up to 2 o'clock here, is have you built any sustainability components into your new long-term walking school bus study that you mentioned?
So that's an excellent question. I think that sustainability, of course, is something that's on everybody's mind. So a lot of researchers are still questioning whether or not the walking school bus does anything in the first place. So the randomized control trial I presented was a short-term trial. And a lot of the previous research has not been experimental. It's been cross-sectional work. And so in the research community, at least, there's still a question of, does this really increase physical activity, and does it decrease body mass index? And so we're still approaching those questions with the funding that we're receiving, so we're trying to answer those questions first, and then we're going to move on to sustainability questions. I know that frustrates a lot of people, but the reality is, at least for those of us doing research in this area, is that we need to establish that this works before we can say, hey, look, we can make this program can go on and on and on and on and on into the future.
Yeah, well, that makes sense.
I know that's not the answer people want to hear, but that's the reality that many of us are living in right now.
Okay, great. Well, it is 2 o'clock, so we are going to wrap up. I want to thank both of our wonderful speakers again, Dr. Salas and Dr. Mendoza. That was an incredible presentation. Remind everyone that it was recorded and will be available typically in about 48 hours on both the America Walks website and the National Center for Safe Routes to School website, and both of those addresses are up on your screen right now. I also remind everyone that our next webinar is coming up, and it is going to be Safe Routes to School in Indian Country, and it's going to be a 2-part series. First time we've done, or actually I guess we have done 2-part series before in the past, but it's been a while. And the part 1 is going to be Understanding Program Development Challenges. So we hope that you can all join us for our next webinar. Again, it's in about 2 weeks on August 25th. You can register at both the America Walks website and the National Center for Safe Routes to School website. So again, thank you to our speakers, and thank you for everyone for joining us this afternoon. We hope to have you on again with us in a couple weeks. Good afternoon, everyone.